My name is Stella. I am from Nairobi, Kenya. I am a teacher and I'm married with 4 children, a boy and 3 girls. My diagnosis is about 11 months ago. I did not know I was sick. So I was diagnosed after I was taken to hospital, and it was an emergency surgery because I had been having some symptoms that I did not understand. I kept on feeling bloated and my stomach had grown so big. I did not understand. I could not control my urine. I kept on visiting the toilet. All those things, I kept on thinking it's because of old age. I'm almost retiring. I'm almost 60 years. So I thought maybe when people grow older, they have big tummies like that, and maybe they cannot even control their urine. So the doctor told me to lie on the bed. He wanted to examine me because I had told him my tummy is so big, I have no clothes to wear anymore. And he wondered what the problem was. So when he touched my stomach, he was shocked. He told me I had a very big mass inside my stomach. It was so large that they told me to go to hospital immediately for surgery. So they booked me into hospital, and I went there. I was operated after 2 days from the CT scan. And when I was operated, what was found was so large. They could not believe I had been walking with such a big mass inside my stomach. So after 2 weeks, I was told to go back after operation. So when I went back to hospital, that is when it was discovered I had ovarian cancer. I had heard of somebody who had had ovarian cancer, the mother of one of my colleagues at school. But it was so late when it was diagnosed. She stayed for about 3 months and she passed on. Otherwise, the most common type of cancer that I always hear about is breast cancer and cancer of the cervix. That is the ones we hear about, we even know the symptoms. Ovarian cancer is really not known, and I think maybe many women in my country do not know the symptoms, just like I did not know. In my country, I think the biggest problem is financing the treatment. It's actually very expensive. And for one, many women in my country do not have employment. They are housewives at home. So I want to imagine it's a big problem because even for me, before my insurance came in, I was just wondering because the treatment was taking almost what I earn in a month. But I was lucky because my insurance was paying for the chemo sessions and any other tests that I was taking in the labs. I know finances are a big, big problem for many women, and most of them could be diagnosed when it's too late. Even after they have discovered the problem, because I see even with the rest of the people who get like breast cancer, most of them do not survive because they start treatment so late because of raising the funds. But I was a little lucky because the treatment was paid for and done immediately after the surgery when the diagnosis was. Cancer in my country is viewed like a death sentence. Most people, because people really die from cancer, there is a lot of stigma around cancer patients. Because I remember even at my place of work, before they accepted, because I told some of my close friends at the place of work, I told some of them, and I think they told others whom I did not want to know. It's actually, there's a lot of stigma around cancer. People start looking at you like, you are dying the next few months. So sometimes people keep quiet and they do not announce what they are suffering from. But I decided to tell people, like all my friends knew, my neighbors knew, all my relatives, and they knew what I was suffering from. So I wanted people to know that people suffer from other types of cancer apart from the common ones that we have in our country. And I was okay with it. I have not heard of any organization, especially for ovarian cancer. Nobody talks about it. I've never heard about it. So there is nowhere. I just talk to friends about what I've gone through. I've not even met one person who has had ovarian cancer, apart from the example I gave of the lady who passed on after a very short time. There is no organization that talks about it. And I don't know. Maybe there could be one, but I've not heard. I would tell them to look at ovarian cancer like any other disease, but most importantly, to observe their bodies and see the changes in their bodies, because most of those changes do not come as a problem. Like when you start having a big belly, like I talked about, especially for the older ladies, do not take it like it's very normal. So just to observe their bodies and to go and see the doctor as soon as you see there's something wrong with you. Regular checkups from the doctor. Most of us do not do that. If there is any way I can also create awareness about this, then it's something that I would be willing to do, because I've never heard anybody talk about ovarian cancer.